My name is Caitlin Barrett, and I am a member of the Board of Directors for the Coalition Against Childhood Cancer. It is my honor to join Vazo Rahimzadeh to share developing a working paper to cultivate ethically sustainable relationships among stakeholders when nonprofits fund pediatric cancer clinical trials. The overview you will see today was prepared by the Coalition Against Childhood Cancer Ethics Think Tank. Neither I nor Vazo have anything to disclose. The Coalition Against Childhood Cancer, from here on out in this presentation referred to as CAC2, is a collaborative network of nonprofits, corporations, and individuals from 36 states and 5 countries that support and serve the childhood cancer community. Prior to every meeting hosted by CAC2, we review our values as they define our activities and interactions as a collaborative. CAC2 strives, first and foremost, to put the children and their families first in everything we do. Toward that goal, CAC2 supports its members and the childhood cancer community while being mindful not to compete with members or duplicate projects, programs, services that they provide. Being cost-effective with resources, being inclusive and collaborative, helping to give voice to the community and amplify it in a coordinated fashion, and staying action-oriented and flexible. CAC2 members unite to identify and complete initiatives in the areas of advocacy and awareness, family support, and research and treatment that individual organizations are not able to complete and manage as easily or effectively alone. The goal of these collaborative projects is to develop knowledge or programs that benefit the larger CAC2 community. The CAC2 projects do not begin in a vacuum. They begin when minds unite around a challenge facing the childhood cancer community. This project was no different. At a CAC2 annual summit in 2017, several members of the CAC2 community began discussing how to explore the issue of ethical considerations that nonprofit organizations face in funding research and clinical trials, and the suggestion was made that CAC2 would invite a bioethicist to the 2018 meeting to discuss high-level ethical issues in the research field. Dr. Yoram Unguru, pediatric oncologist and bioethicist from the Herman and Walter Samuelson Children's Hospital at Mount Sinai and the Johns Hopkins Berman Institute of Bioethics, was invited to deliver the keynote address. His talk inspired further discussion, and one of the breakout group sessions for the research interest group, led by Amy Weinstein of the Pediatric Brain Tumor Foundation, Donna Lewinsky of Solving Kids Cancer, and Robin French of the Morgan Adams Foundation, began to further probe the relationships among pediatric cancer charities, the clinical researchers who benefit from their funding, and the patients for whom those charities advocate. The outcome of the 2018 meeting was the decision to further explore the matter, and after a preliminary investigation, the group realized that currently published information to address these questions was sparse, and that this presented an opportunity for CAC2 to become a thought leader in the area. They also believe that with childhood cancer patients and families facing the most difficult times of their lives, nonprofit organizations should follow ethical funding practices and present themselves in a manner that meets the highest ethical standards. The group set as its goal to study these issues and produce a paper that would be a novel contribution to the literature and a help to the community. Armed with this information, the 3 CAC2 members decided to submit a proposal to the CAC2 Project Incubator for consideration. The CAC2 Project Incubator process has been a critical tool for helping CAC2 identify and follow through on ideas that individual organizations can't complete and manage as easily or as effectively alone. The CAC2 Project Incubator supports this process by encouraging CAC2 members to submit concepts of collaborative projects that fulfill the CAC2 mission of fostering and sustaining greater levels of collaboration, information exchange, and learning across the childhood cancer community. The Project Incubator helps guide an idea through the process of refinement, presenting the concept to the full membership for endorsement, and support for engaging the greater community in the execution. In late 2018, the group proposed the project to the CAC2 project incubator to assess members' interest in researching ethical issues with a goal of clarifying the opportunities and potential constraints going forward. The incubator process helped us determine that we needed to hire a bioethicist to help with narrowing the scope of our question, and we engaged Dr. Vazo Rahimzadeh, whom you will hear from next. Vazo is an applied bioethics scholar in the Stanford Center for Biomedical Ethics with research interests at the intersection of precision medicine, data governance, and public policy. The CAC2 ethics think tank team engaged Vazo to assist us through the process of refining our project goals and performing the systematic literature review that enabled us to explore the current ethical landscape around pediatric cancer clinical trial funding by nonprofit organizations. Vazo, I'm honored to provide you with a platform to take the audience through our research process.
Thank you for that especially kind introduction. I'm now going to walk us through how we set out to achieve our project aim, which was to develop a working paper identifying both the potential ethical issues charities face when funding research, as well as some suggested best management practices for charities that they may use in dealing with some of those issues. I'll share with you some of the methods and the summary results of the systematic literature review that we conducted to answer the following questions, namely, what are the roles, responsibilities, and ethical obligations of nonprofits to 4 different stakeholder groups when funding pediatric cancer clinical trials? And these include patients, researchers, sponsors, and donors. And first things first, we took our research question to the literature and devised a search strategy with the help of a Stanford librarian that would help us capture the greatest number of relevant peer-reviewed articles, commentaries, newsletters, and other white papers indexed in the literature. And we ran this search in 2 primary databases, PubMed and Web of Science. Second, we placed several parameters around the articles that we retained. So namely that those articles were published in English, that they discussed relevant ethical, legal, social, and/or public policy considerations of partnerships between nonprofit patient organizations and researchers, sponsors, donors. And we proposed, and those articles must have included proposed research funding for a clinical trial, irrespective of the type of design that they used. And we excluded articles if they merely discussed strategies and practices related exclusively to corporate social responsibility, or if they discussed financial conflicts of interest solely without addressing any of the underlying ethical, legal, or social considerations that make those conflicts problematic within the nonprofit space. And this slide gives us a high-level overview of the whole process that we undertook in this review, from devising and running the initial search in step 1 to conducting 2 screenings of the articles that came back to us in steps 2 to 3, and then analysis of those articles that we retained. After running the search in step 1, we were given a total of 7,357 articles in which 8 members of this ethics think tank team, including myself, collectively screened titles. And we applied the inclusion and exclusion criteria I just described and worked on an online crowdsourcing platform called Covidence to do this. This left us with a pool of articles that, based on the title, sounded relevant to our research question, but we couldn't know for sure without actually reading the entire article. So that's what we did in step 3, leaving us with a total of 54 articles. And 3 members of the working group then independently analyzed all full text articles and applied what we call thematic coding to extract article information relevant to our review questions regarding some of those ethical relationships between nonprofit patient advocacy organizations and the 4 stakeholder groups. And here's overall what we found. That the proportion of clinical trial funding from nonprofit funders is growing exponentially, especially in areas which have been historically understudied and underfunded by industries such as pediatric cancer. And while this is a good thing for conducting research among the pediatric cancer community itself, nonprofits are themselves not subject to the same regulatory standards and oversight in terms of trial conduct, reporting, and quality. We found that trust and transparency are critical in rising to some of these regulatory standards, including having a robust scientific ethical review, regularly reporting on trial progress, and keeping donors informed about the types of trials and research priorities that are being undertaken. And while we acknowledge that we've been able to shed additional light on at least some of these ethical areas of sustainable practice in trial funding, that really the making of good research is that it should raise more questions than it answers. And indeed, this was the case here. So we identified critical gaps that were not well captured in the literature, but are emerging issues. So namely those about how to manage relationships when stakeholders cross different stakeholder groups, including when donors are potentially research participants, when researchers have conflicts potentially with other industry sponsors and partners. We also identified issues relating to the recruitment of trial participants, particularly when those patients and families are a part of the organization which is funding the trial, and also ethical issues surrounding when there's a potential conflict of interest among the organization itself in an emerging area which we found called entrepreneurial philanthropy. And so we plan to synthesize these findings in an internal white paper that we are currently circulating through the organization, and have some plans to continue both the implementation and evaluation of that white paper and provide some brainstorms of those future directions. Here, we'd like to develop a framework for how to track progress on some of those recommendations that we make and were identified in the literature, and conduct some informal follow-up with respective members of CAC2 to determine their applicability and feasibility. And I wanted to take a moment to recognize the commitment and the passion of members listed on the screen here, as well as their partner organizations and the funders for this project. This is truly a participatory effort, really from conception to execution, and an exemplar for what nonprofit and academic partnership can really look like moving forward as new novel ethical, legal, and social issues emerge. And we certainly look forward to discussing many of those emerging areas with you during the discussion section.